Radiological view of Dandy-Walker malformation. Dandy-Walker malformation is the most common posterior fossa malformation. It is characterized by the triad of hypoplasia of the vermis and cephalad rotation of the vermian remnant, cystic dilatation of the fourth ventricle extending posteriorly, enlarged posterior fossa with torcular lambdoid inversion, the torcular lying above the level of the lambdoid due to abnormally high tentorium. In a classic Dandy-Walker malformation, patients usually manifest in the first year of life with symptoms of hydrocephalus and associated neurological symptoms. Many have a sporadic inheritance, with some possibly having an autosomal dominant or X-linked inheritance. Radiographic features. Ultrasound. Antenatal sonographic features that would suggest the diagnosis include: marked enlargement of the cisterna magna is greater than or equal to 10 mm. Complete aplasia of the vermis. A trapezoid-shaped gap between the cerebellar hemispheres. Antenatal ultrasound may falsely overdiagnose the condition if performed before 18 weeks, as the vermis has not properly formed. MRI is the modality of choice for the assessment of Dandy-Walker malformation. Majority of patients have obstructive hydrocephalus is evident by 3 months of age, in many cases due to aqueduct stenosis. CSF flow study is recommended to better assess the hydrodynamic changes and identify eventual aqueductal stenosis association. Associations. Non-syndromic CNS associations are in majority of cases. Other CNS abnormalities are present. Cortical dysplasia, polymicrogyria, or subependymal gray matter heterotopia. Dysgnosis of the corpus callosum. Lipoma of the corpus callosum. Holoprosencephaly, schizencephaly, occipital encephalocele, lumbosacral meningocele, syringomyelia. Non-syndromic non-CNS associations are in 25% of patients. Cleft palate, facial angiomas, low-set ears, polydactyly or syndactyly, cardiac anomalies. A Dandy-Walker malformation carries a high mortality rate, majority of live-born fetuses, often due to associated abnormalities. It is thought to carry a poorer prognosis if diagnosed prior to 21 weeks of gestation and a better prognosis if diagnosed postnatally. A cystoperitoneal shunt could be considered in situations where hydrocephalus is a significant problem.